Welcome back to Loving Living Local. It's time for another Medical Minute. We are at the Colorado Springs Orthopaedic Group. Joining me is Dr. Simpson. I am so excited to talk to you this morning. You are the orthopedic foot and ankle specialist here, and we are going to talk about ankle replacements, which I had no idea that you could even do.
They do.
Okay, so can you kind of tell us what's the difference between an ankle fusion versus an ankle replacement?
Yeah, so an ankle fusion has been a tried and true procedure to help patients that have ankle arthritis. So both ankle fusion and ankle arthritis are procedures that we do for arthritis, as though you would have in your knee or your hip or your back. But an ankle fusion is just like it sounds. We actually fuse your ankle bone so it doesn't move anymore. And the goal in doing that is to decrease pain. Now, a replacement allows for continued motion. So just like your knee or your hip replacement, we can replace the ankle when it wears out, so you can still have motion of the actual ankle joint.
Okay, can you kind of show me on the model? Whenever you do an ankle replacement, what is it that you actually are replacing?
So we are replacing the bottom of your shin bone, which is your tibia, and the top of your talus bone, which is your ankle bone. And these two bones articulate or move up and down like so. So we want to preserve that motion while decreasing the pain of arthritis.
Okay, so when you're trying to decide who should have a fusion and who should have a replacement, can you kind of like show me what that looks like and why you would do that?
So it's more than just this, but we do look at the actual position of the bones. If the bones are crooked, it's a lot harder to put a replacement in because the replacement is under a lot of stress. Other things that we look at are the patient's body habitus. You know, if you're overweight, unfortunately, you may not be a candidate. If you have a lot of medical comorbidities, or if your bone quality is poor, we may not be a candidate. And also, we take into account your actual physical activity.
So if they're not a candidate for the replacement, then you can still do a fusion.
And a fusion has great outcomes as well. Again, our goal is to get patients back on their feet, decrease their pain, and get them back to what they want to do, and either surgery can do that. Okay,
so when we're talking about injuries and that kind of thing that happens, what should I be careful to make sure that I don't need to get an ankle replacement or a fusion? What kind of injuries would cause that?
So if you sprained your ankle back in high school and it was really, really bad and you never got it treated, that ongoing motion of the actual bones will cause your ankle to wear out faster and cause you to get arthritis, which will lead you to need to have an ankle replacement. Same thing if you break your ankle and the bones are out of position for any amount of time, they may heal in an abnormal position, requiring you to have either an ankle fusion or an ankle replacement.
This is why it's so important. If you happen to have something happen with your ankle, you have to get it checked out.
Come see us, let us take a look, and at least let you get you fixed, and then we can get you back.
And don't forget they have the express clinic, so you can just walk in. You don't have to make an appointment and wait for weeks. You can just come in and say, I'm having an issue here, so please take a look at it so I don't have to get an ankle replacement in 20 years. Okay, so are there preventative measures that we can take to make sure that this doesn't happen to us, so you don't ever have to see us?
Definitely. So as we're treating arthritis, such as in any joint, you know, we can help you lose weight, we can provide you a brace, we can get you some physical therapy. We can also do things like regenerative medicine and injections, cortisone injections, and arthritis medication to kind of delay the inevitable need for an ankle replacement or an ankle fusion.
Because you don't want to start putting hardware or anything in somebody that's younger.
No, not at all. No, we want to delay that as long as possible.
Okay, so can you kind of tell us if somebody does have to get this, it can really help with the quality of their life and make things a lot better for them. So if somebody has to come in and get an ankle replacement or an ankle fusion, what does that recovery time generally look like?
Yeah, so nowadays what's great is this can actually be done at an outpatient surgery center. So at our outpatient center, we can do surgery as an outpatient. Typically you're off your foot for about a month, and then we actually get you walking after about 4 to 6 weeks.
And then do you do some sort of physical therapy to get that moving again?
Yeah, physical therapy to get things get your motion back and get you back on your feet.
Wow. Yeah. I think it's incredible the things that you can actually do to keep people mobile.
For sure.
You got to have your feet working properly. Right? You got to use them to get to where you need to go your entire life.
Right.
I appreciate whenever you come and sit down with us and talk to us about this. Thank you so much for your time.
You. Appreciate you.
If you'd like to get some more information on Colorado Springs Orthopaedic Group, very simple. Just go online to csog.net.